Hi, everyone. My name is Sehej Singh Johal. I am a student representing UCSF, and I first want to thank you all for giving me the time to talk about my abstract. And my abstract is focused on community based health screenings in Gurdwaras, also known as Sikh places of worship, a culturally responsive model for preventative care in the Punjabi/slash Sikh population. Now, to give some context, in general, geriatric patients in the US, we are seeing rising rates of chronic diseases such as hypertension, diabetes, obesity, and heart disease, just to name a few. Specific to the Punjabi community, we want to investigate if these are just medical trends or if they reflect a deeper lifestyle and systemic issue that come with migration from Punjab, India. Now, for some context, many of these older immigrants come from agrarian lifestyles in Punjab, which includes physically active lifestyles and also whole food diets. But in the US, they face very stark changes, such as processed foods, sedentary jobs, post stress migration, and probably most importantly, language isolation. But despite this need, access to preventative care is often limited, partly because of language barriers, lack of cultural alignment, and um, a mistrust in the healthcare system in general. Now, here's the major question: where is a trusted space in this community? And the answer to this question is the Gurdwara, also known as a Sikh place of worship. Beyond just being a place of worship, Gurdwaras are full of community life, largely made up of older adults. So, this makes them ideal sites for health preventative care screening, where it's trusted, it's accessible, and it's culturally familiar. Now, let's go to the study objective. In simple terms, the central goal of this study is to test whether health screenings done at Gurdwaras can actually make a difference. So, we want to look at two things: feasibility and impact. Can we consistently set up these clinics? And also, do people come? And if they do, does it lead to increased health awareness, detection of undiagnosed conditions, or even behavior change over time? Now let's go to the methods. Now, a key part of our methods is a nonprofit that we're working with called Sikh Health Network, which is an organization that enables free health and wellness clinics at any Sikh temple or place of worship in the world. Currently, Sikh Health Network has over 14 clinics at Gurdwaras across the country. And with Sikh Health Network's help, we are organizing free health screenings at Gurdwaras across the country with a focus on adults ages 60 and above. And these screenings will be comprehensive and efficient. We're going to take vital signs such as blood pressure, heart rate, oxygen saturation, BMI, blood glucose levels, and in addition to all the conditions and metrics that are relevant and important for a study in this population. Furthermore, all services will be offered in both Punjabi and English. This includes a team that includes a licensed physician and bilingual volunteers. And the main thing about these clinics is that we're not just taking readings, but we're offering brief, personalized, isolated, um, and private counseling and helping the patients understand what these numbers mean. So, how do we collect this data? Well, we use a HIPAA compliant EMR system to track patient data securely. And our plan is to return to the same Gurdwara every month to offer a follow-up screening so we can see trends and progress over time for each individual patient. So, what are we hoping to learn? Now, let's go to the expected outcomes. First, we want to understand how prevalent chronic disease indicators are in this older Sikh Punjabi population. Then we're looking at whether this type of community-centered screening leads to action. For example, do um, you know do these patients follow up with their own doctor? Do they start changing their own diet? Do they improve their own biometric health screenings over time? And also, we want to see, and there's many questions that we are postulating for healthcare seeking patterns, such as, what brings people to the clinic? Are they comfortable in going to their primary care clinic? And does coming to a Gurdwara clinic reduce those barriers of stress or a language barrier, for example? So now I want to go to the significance. Why is this significant? Well, by embedding preventative healthcare services within Gurdwaras, it provides a scalable and culturally sensitive model for addressing health disparities for Sikh immigrant populations. And the thing about this abstract and this study is that it's not that this model can be used not just for the Sikh community, but for any community: Jewish, Christian, Muslim. And the whole idea is that it may inform public health strategies for improving preventative care across linguistic isolated and underserved communities. Um, and I do have one more slide that I want to show. And before I do that, I do want to share some pictures on the right hand of the screen, where these are some of the clinics that we've hosted. The Sikh Health Network has hosted at certain Gurdwara, and as you see in each picture, there is a physician that's doing consultations, and we see that at every clinic, and we find that beneficial for not only for the patients to be aware of their numbers, of their blood pressure, of their blood sugar, etc., but also understand what those numbers mean in terms of their overall health. So the next slide that I'm going to show shows the preliminary data from Sikh Health Network. And the overarching message is that the Sikh community is not that healthy. This is from the Sikh Health Network clinics. This shows data of systolic blood pressure from over 2,000 patient encounters over 3 locations in a 12-month plus span. And this basically shows, the quartile 1, median, and quartile 3 as well as the range per age bracket. And this shows that median systolic blood pressure increases with age, with the highest values observed in the 65 plus group. The older age groups show greater variability and more hypertensive outliers. So this highlights the potential need for targeted screenings and intervention in these populations. And that is the whole point. Why are we doing this? We want to highlight the need for awareness and preventative care in the Sikh community. And with that being said, that is it for me. I want to thank you all for my time, and I'll take any questions right now. Thank you very much.